Hey, everybody, welcome back to the Modern Customer Podcast. I'm your host, Blake Morgan. My guest today comes from Strive Health. Today we have Evelyn Goodfriend on the show. She is the Chief Customer Officer. Strive Health has 700 employees, or as they call them, Strivers. Evelyn has 25 years of healthcare industry experience across different payers, providers, and tech enabled solutions, including customer facing roles at Accenture, Kaiser, and Evolent Health. Today, we are talking about her first 90 days in the role as Chief Customer Officer. We're talking about healthcare and the opportunity to disrupt. And we're looking at some recent exciting use cases for AI and how it can improve patient experience. Please enjoy Evelyn Goodfriend. Evelyn, welcome to the Modern Customer Podcast. It's so nice to see you today.
Thank you. I am excited to be here.
Yes,
Such a privilege.
I love to be somebody's, not to put you on the spot, but that you told me this is your first podcast, which I
It
feel so
is.
honored.
I feel very excited and candidly humbled to be having a conversation with somebody for whom many of industry leaders, category defining brands, and I feel like we're going to be a different conversation today.
Oh, well, you are category defining, absolutely. I think everyone listening or watching knows someone impacted by kidney issues. But let's back up. We're kind of starting a little, we're getting ahead of ourselves. Let's talk about you, Evelyn. Tell us
All right.
about your career, like the elevator, a little bit longer than elevator pitch about your career and who you are.
Sure. So I have been in healthcare most of my professional career. Started early on with what I will call a calling that I knew I wanted to be in this industry and spent a lot of time trying to figure out what it meant to be in this industry, like where I wanted to play. Spent some time actually as a call it a professional caregiver. I explored finance and law and public policy and politics and eventually landed on business as my entree into the world of healthcare. And over the course of the last 25 years, I've spent time working with large insurance companies, with large provider organizations, and hospital systems, and most recently in a couple of really exciting early stage growth companies that really have at their core a mission to make healthcare better for people struggling in their day-to-day reality and get them to a better experience of health.
I love that. Healthcare is such a difficult industry. I feel like it's
It
gotten
is.
so much crazier with insurance, with the cost of healthcare, with now how we pay for these weight loss drugs. And it's such an interesting time. Like the whole healthcare industry has changed, I feel like, in the last 18 months. Is that impacting you at all? Do you believe it has changed?
It is, I think maybe the good news and the bad news is healthcare is always changing. And I think one of the fundamental challenges that we have in healthcare, and there aren't many other industries like this, the person or the entity that's usually paying for the care is not the person who is consuming the care, right? Most people are fortunate enough to have, or a lot of people are fortunate enough to have health insurance, whether that's paid for by their employer or by the government, subsidized by the government. But the actual consumers of healthcare are individuals. And so this is a relatively Byzantine system of misaligned incentives that makes it very complicated. And new drugs can be expensive, even though they are incredibly valuable to many, many people. For the business we're in today, government decisions about how physicians get paid and the cost of drugs have a material impact on both the work we do and the people we're trying to help. So unequivocally, it's a tough time.
Yeah, I've never in the podcast heard anyone drop the word Byzantine. So now we have to ask you, what makes it Byzantine?
Do you feel like you can explain to your mother or a parent how it should work for them and what they need to do to see a specialist or ask a question about whether or not, for example, GLP-1s are good for them?
Oh gosh. No.
Or could you explain it to yeah, so and I think that's what right? It's too complicated, right?
Yeah. Well, my
Where
dad is a doctor. He worked at Kaiser for over 30 years.
oh, right.
I mean, probably could talk to him about it, but yeah, it's so complicated. And I think most of us as consumers of healthcare, we don't even understand how things work and we don't understand why it's so expensive. So let's put a pin in that and talk about what you're actually doing and what is Strive Health.
Great question. So, Strive Health is what we call a specialty care company. If we want to get into the lingo, we call it value based care. And we are providing clinical and navigation services to people who are struggling with advanced kidney disease. And when you have advanced kidney disease, and technically speaking, this is in advanced stages, you also probably are struggling with a large number of other complexities and chronic conditions that just make managing yourself, let alone this disease, very complicated. And so we exist because the system does not appropriately align and coordinate around this complex situation for someone with an advanced disease like kidney disease.
What was so shocking when I learned about kidney failure is that people need to go who have this problem. They sit in a place where their blood is cleaned for, I think, 3 hours, like 3 times a week.
Correct.
I mean, that's just to survive. And
Correct.
like, can you imagine? Like, really think about it, everybody, like what that would entail for you and how much that would cost.
The cost is staggering, and if you've ever driven by one of these dialysis centers, they tend to be windowless concrete buildings in places that don't make you feel good or better about the very challenging situation you're in, and you're absolutely right, it is a matter of survival. Most people who find themselves with end-stage kidney disease and are on dialysis often end up on dialysis through a visit to the emergency room. Stressful, expensive, highly intense experience. And their mortality rate is very, very high. Most people don't make it a year when that's how they find themselves on dialysis. So it's not a good place to be. And I think when you think about it from a patient experience perspective, sitting with what that must be like, I must dedicate so much of my day 3 times a week to sitting in this chair simply so that I can survive, it becomes a real burden. And just even, you know, an 86-year-old woman who also has CHF and advanced diabetes and probably has food insecurity, the idea of just getting out of the house, let
Mhm.
alone getting to that chair, feels like a monumental effort that is a struggle every single time.
How does Strive help these kidney patients?
So that's a great question. So we have a cross-functional team. We call them kidney heroes, and they are led by a physician and a nurse practitioner. And it includes registered nurses, dietitians, care coordinators, and patient navigators who really try and surround these people with the support they need, not only for their medical and clinical needs, but to address other issues that may be getting in their way, like they need a ride to dialysis or they need a ride just to go see their nephrologist or cardiologist. They're not sure where their next meal is coming from. Or, you know what? They just need a new microwave so that they can have some autonomy at home and warm up food. And so we try to do our best to wrap around them the support they need to avoid their disease progressing and their condition becoming more complex.
And so, do you bring this dialysis to their home as well?
We do not do dialysis. So we coordinate with the dialysis providers and most patients will have the option. Part of the education process as their kidney disease advances is to have a conversation about whether they want to have dialysis in a center or have home dialysis. But candidly, Blake, most patients don't feel comfortable choosing home dialysis, even though it's much more flexible and will allow them to have more control and autonomy over their day to day. So
Mhm.
we see a very small percentage of people choose home dialysis, and we're very much involved alongside their nephrologist in the education process to encourage them to evaluate all of the options.
So, I read that you serve over 121,000 people. Like, how does that work? Are those customers or those providers?
Great questions. Yeah. So, the way the Strive model works is we have call them big C customers, right? And then we have the consumers or the patients we see serve. So, Strive has a portfolio of about 15 different customers. with whom we enter into an agreement to take care of everybody with advanced kidney disease in a population. And it is then incumbent on Strive in partnership with our customer to outreach to these patients and engage them in our clinical programs and help them adhere to the advice and counsel of their multidisciplinary care team in the hope that we will improve their clinical trajectory. And ultimately, what the big C customer cares about really is to lower the cost of their total, their overall care.
Got it. Love it. So why kidney disease? Like why did the founders decide to target this particular healthcare issue?
Like many things in healthcare, there was a very clear founding story. Our CEO talks about a very close friend of his who's he's known most of his life, who really did not know his kidneys were failing until too late. I think he had also worked inside a large dialysis provider. And so it really became a mission to create not only the education and the access, but the support needed to survive with advanced kidney disease. Because dialysis is one option. And within dialysis, you can choose between the home or the center, but there's also transplants, and transplants can be very successful and get you much closer back, get you much closer to an independent life than dialysis
Mhm.
obviously would.
Mhm. So we've spent a lot of time kind of talking about the mission of the company and what you do. Let's talk about your role, your CCO role.
Yeah,
First 90 days. First of all, let's establish, was this the first CCO at Strive?
it was a really exciting opportunity for me to come in and define what customer success looked like as the chief customer officer. So, Strive is a venture backed company, and part of the investment thesis for the Series C was to put somebody in place who was accountable for the retention and expansion of a really strong book of customers. And so, I was brought in to build out a team whose job is to be the eyes and ears to these customers around our performance in these contracts. And it's a pretty complex role because we don't have one customer. We have inside a large health insurance company or a large primary care group, we have a number of stakeholders that the team is playing the role of convener and coordinator inside Strive so that we show up with one voice and a clear story when we're interacting with them.
Yeah. Love it. So first 90 days, what were some of the main things that you were trying to do?
Great question. So, first 90 days, one of the big focuses was just understand what our customers thought versus what we thought was really going on. So, um, I firmly believe in start by listening. So I went on a listening tour, right? To the extent I could, I met in person or I got on the phone with key stakeholders from our customers to understand what they thought of Strive. My boss said to me, like, I feel like we're telling ourselves only the good news, and it can't be true. Strive had been surprised by a termination, right? Really happy conversations, everybody nodding their head, everybody would leave meetings feeling good, but then the customer turned around and terminated the relationship. So, job one, avoid for further surprises. And I think that really required us to listen to what the customer was actually saying and thinking about how we were doing. Two, figure out what our story is. How are we managing their expectations about what we're trying to accomplish, the progress we're making, and what evidence we have to give them confidence that we're going to deliver on those expectations. It's one thing to show up with reams of data about what patient engagement looks like today and whether or not we're reducing admissions, but they really required context. Is this good? Is it not good? If you're not making enough progress toward the target, what are you doing about it and what help do you need? So we really needed a story. How do you know what good is? And so we started to shape a scorecard and use data to say one of our key metrics that you're going to measure is patient engagement. Are we engaging enough people to know that if we engage them in the program and they stick to our advice that we will improve their clinical outcomes and reduce cost? Okay, what's our target? What does good look like? Where are we? And are we making enough progress on that process? So really using um, figuring out how to use data to set and manage expectations. And then I needed to build a team. So, what capabilities are required? What are the skill sets we have versus we need? And get going on the process of building out a team.
I love that. And I love how clearly you outline basically 3 to 4 steps. I feel like that's so important in the first 90 days. And then past the first 90 days, what were some of the goals you had and how did you measure success?
We It was really about retention and expansion, team environment and culture, and customer satisfaction. So, one of the first things we did was establish a baseline. What do our customers think? How are they feeling about us? And trying to apply some data to that. So, we put a 5 question survey out there, like ask them, what are we doing well? What are we not doing well? What's one question we haven't asked you, right? A very simple 5 question survey to get a sense for where were starting. And what we learned was, in general, our customers really like us. They thought we showed up well, and they liked, the people they were interacting with, but they still really had questions about, will we deliver results? And so early on, it's hard to deliver results because it takes time to, call Evelyn, engage her in a program, work with her for a long enough time where you feel like she hasn't gone to the hospital, she hasn't gotten worse, and then see that come through in a series of lagging indicators, your medical claims, right? So that's a long process to know that it's actually working. And so we needed to establish, what are we doing in the near term to give you confidence that that's coming. So that was a huge part of what we were working on. So goals around, and then, it's a small list of customers, but they're very complex agreements.
Mhm.
And so if we needed to renegotiate or expand, a pretty time consuming process to work through all the contractual terms to make that happen as well. So just understanding the structure and refining and improving the structure of the relationships was also a huge part of the focus as well.
I love that. I think that's so smart. It seems to me most of what you offer is the technology platform, being the project manager, the go between among all these different players, and really being the customer's advocate to make the process clean and zero friction and seamless. So, from a technology perspective, every CXO I have on the show, we do talk a little bit about AI. Are
Yep.
there any AI wins that you've had so far?
What we're really excited about, and you use the right word for us too, is removing friction. And we've really started our investments with starting with, how can we remove friction from our caregivers workflow in order to make their ability to interact with the patient smoother, and more delightful, candidly, right? So, how does an ambient scribe mean that they're paying more attention, able to look the patient in the eye versus trying to copiously take notes? How do we use AI to pull forward all the historical information so you don't have to go through that tedious set of questions again and again, which most of us experience every time we talk to a new provider? Have your medications changed? Did you take your medications today? Like all of those things, which you're like, for the love of God, I've told you this already. Like trying to bring forward all of that information so it's a much more personal and engaging experience for our care team. And I think over time, it will evolve, to how do we deploy technology into the home, whether it's for a caregiver or a patient? How do we use, advanced AI learning to get smarter about different ways to engage different people, right? Nobody wants to be called at dinner time. Nobody wants to really be called by their insurance company. So, how do you get smarter about when to call Evelyn versus when to call Blake with the highest possibility of a positive outcome? So,
Yeah.
really starting with that, patient caregiver interaction as the first point.
Evelyn, I imagine that your patient, they're a little older in age. And from a technology perspective, that can be challenging. What do you do to make it easy for these older patients to engage with the technology?
I think we're learning, because you're absolutely right, and I had the privilege of visiting a couple of our patients earlier this summer, and I have to tell you, technology was the furthest thing from their mind.
Right.
And so I think, in for our patient population, and just to give you context, the two people I visited were probably African American women in their 80s, very complex medical situations, and both of them probably had food insecurity and no transportation. Um, One of them didn't even know where her iPhone was because her primary care doctor wanted to talk to her, and so we had to put the phone next to her, plug it in, and make sure that it was working so she could receive that phone call. So I think for our patients, a lot of the technology needs to be pointed at the caregiver. That family member or paid home care person who is trying to help them do the next best thing for them. And so I think there is a lot we can do in terms of whether it's an iPad in the home or real-time chat on a phone, just to make it easier to verify that Strive is legit, like we're not an internet scam trying to take advantage of your mom in a vulnerable moment. We have tools for you. You can book an appointment, you can change an appointment, you can call us in the middle of the night. I think it's a lot about the caregiver with the population we're actually serving.
When we think about disrupting healthcare, what do you think is the biggest opportunity right now?
Ooh, if I knew the answer to that, I think I'd be much wealthier. Um, we continue to need to figure out ways to deliver what people need where they need it before they know they need it. And it's often not really healthcare, they need care.
Mhm.
Right? One of the women I visited, she needed her little life alert to work. Somebody in her family had given her one of those little devices, and so she couldn't make it work. She couldn't get it set up. So we had 30 minutes in her home ostensibly to talk about how her physical condition, but we spent 25 minutes of that on the phone with the 1-800 support number for that life alert
Mhm.
trying to make it work, and between the two of us we couldn't.
Okay. Ha
So that's what they need, like, they need somebody to make sure their medication is in arm's reach, they need somebody to help them get a new microwave before they can even think about, "I need to get to the doctor because my leg really hurts," and the woman from Strive who visited me told me I have a blood clot that could result in a hospitalization if I don't take care of it.
Yeah.
There's so much getting in the way of the healthcare piece of it.
Yeah, I think older people just need a lot of help. So, my hope is that as AI takes over more of the menial work, we'll have more
Oh,
humans to serve this, like, struggling population.
well, and I think what I am really excited about is can AI actually get to the point where it can help us anticipate
Yeah.
to right? Can it help us put the right person in Evelyn's home today for what Evelyn most needs? And it's really not a licensed clinician. She needs, a teenager doing a service project to go in and just make sure the phone is plugged in and there's food in the fridge.
Yeah. Wow.
That would be amazing, right? And maybe have a 10-minute conversation with the person just to make sure that they're actually okay.
Yeah, the costs of aging are really crazy. Like, living in an assisted living is an absolute fortune. And most people can't really have their family living with them, like children of elderly. So we're sort of, as a society, facing this conundrum. Like, what do we do?
You're right. Yeah, and I think, like, so for my mother, born, in 1939, the idea of kind of effectively paying rent at the end of her life is really uncomfortable, right?
Yeah.
She's worked she and my dad worked really hard, they feel like they have some security and safety, but the notion of, like, just paying rent to live in that type of situation at the end of her life doesn't feel good either. And the
Mhm.
loss of independence, that comes with it is also pretty challenging.
You know what we're all wondering? Where does she live?
Oh, my mother?
Yeah.
Minnesota.
Oh, okay. I thought maybe she lived with you, or because you said she doesn't want to live in assisted living.
She doesn't and, God bless her, she just turned 86 and she lives in the house I grew up in with her dog.
Oh, yeah.
I
My
know,
my
it's pretty
dad's
amazing.
about 10 years younger, and he still feels really good and energetic, but I keep warning him, like, "You need to live closer to me." Just anyway. But,
Yes, I have 3 siblings and she lives close to one of my siblings, so there's
oh,
somebody who can be there quickly, for
that's
sure.
good. That's awesome. Well, I think tech is such an interesting time with AI to take on these industries that historically have a lot of problems and just feel tough to
Yes.
tackle some of these big societal issues and tackle something that's so hard like kidney dialysis. So, like, good on you for doing that.
I think a lot of people in healthcare and at a company like Strive really do come for the mission, right? We want to do good, we want to do better. Walking in the shoes of some of these individuals, like nobody woke up today wanting to be a patient, right? Of all the things you
Especially
are, or
that
of
type
all
of
the
patient. So
right, exactly. Of all the things you are today and you want to be known for. I'm a mom, I'm a sister, I'm a friend, I'm a daughter, I'm a wife. Like it is pretty far down the list before you get to patient as a
right.
label you want, right? So how do we get better at seeing people versus patients and
Yes.
responding in that way?
Yes, yes, because the whole point of customer experience is not treating customers like wallets, like transactions. And in healthcare, like, I mean, I just went and got my first mammogram, and, that was interesting. Like, I'm just, as an customer experience researcher, like, oh, how do they
Yeah,
treat you? You go into the room, it's absolutely freezing. You're like, are those things going to clamp my body? And just, it's just,
yes they are. Like and you can set aside who probably designed that and knowing that they didn't have to experience it,
well,
right?
just like it's so cold. And I just said to the
For
woman, I'm
sure.
like, it's so cold. Can I wear my jacket? She's like, no. It's like,
Nope,
yeah.
you
So
absolutely not.
it's just patient experience has so much work to do.
You're absolutely right, and I think it goes back in part to the fact that in many cases, the entity that's paying is very disconnected from the person who's consuming, right? Kaiser is a lovely example of an alternative where it's all under one roof and it affords them much more freedom to be patient-centric and to really design an experience for the patient. But most people live outside of that, and it is very hard to be patient centric when you have all these competing incentives and demands.
Even, yeah. And even the best are not perfect. That's why like my work in customer experience is always interesting because even the highest performers always have work to do. It's every day. It's constant.
That absolutely. And that's, I think, what makes it so exciting. And we do have an opportunity and always have an opportunity to learn from outside examples of good customer experience. I travel a ton. And so one of the ones that I always kind of benchmark again is United Airlines. I live in San Francisco. If I need to go anywhere, I'm going with
Yeah, you've
United.
got
And for
that new
better or
terminal.
yeah, and for better or worse, United and I have been together for a very long time. I don't want to admit how many sort of butt miles I have, with United Airlines, but they have figured out how to put in front of me what I need before I know I need it and give me a range of options to customize how I
You
interact
must be
with them.
global services because you're so
I'm not
happy.
anymore.
Oh, you lost it. Oh, no.
Yes.
United, we have to fix yeah, I'm same. United used to live in the Bay for 10 years, so I'm very familiar. It's
Yeah,
interesting
but,
though,
like
like, what caliber of customer you are really does dictate your experience, because someone that just flies
absolutely.
United randomly probably doesn't feel like that as, in
Not
contrast
at
to you.
all. That's exactly right, but even if they don't fly United very often, they can decide whether they're gonna use the chatbot, a kiosk, um,
Yeah, they've made
you
a lot
know
of improvements for sure.
yeah, like, they've made it pretty easy to decide how and where you wanna interact with them.
Yeah, absolutely. Well, this has been so interesting and so fun. I feel like there's so much we didn't cover, so you'll have to come back, but we have to have a
Be
little
my
fun
pleasure.
before I
Yeah,
let you
yeah,
go. Ready for some quick rapid fire?
I'm ready.
Okay. All right, Evelyn, what's the most important part of your morning routine?
A good cup of coffee and the New York Times.
Okay, and then what do you do to relax at the end of a hectic day?
Read a good book.
What TV show are you currently streaming?
I just finished season 3 of The Diplomat, and it was amazing.
I love it too. I kind of want to have her like messy haircut. Okay.
I know, right? She's making messy chic, right?
Yeah, I'm like, my hair looks too brushed. I'm not fashionable anymore. What's your idea of perfect happiness?
A long hike with my family in the mountains.
What is one mental health strategy for managing hard days?
I hop on my Peloton and I pound it out.
Mm-hmm. Got it. What's your favorite type of vacation?
I like to go to one place and have a combination of sitting and exploring. I am a history buff, and so love the opportunity to immerse myself in local markets and museums and, cities and villages by staying put. I don't like moving around.
Got it. If you could have lunch with anyone, dead or alive, who would it be?
I'm gonna break a pattern, I think, but say I have always wanted to have a conversation with Elizabeth the First, the Queen of England.
Love that. No one's ever said that. Good answer. Um, if you had to describe your outlook in one quick motto, what would it be?
I am the mother of 2 teenage girls, and so feel very strongly that they have a different experience and that we widen the path, for the next generation, and so, um, we regularly talk about be brave, be curious, and be kind.
Love that. I have a 9-year-old, so we'll be there soon. This has been so
Good luck.
fun. If people want to get involved or learn more about Strive Health, what's the best way to do that?
We are online, you can find us at www.strivehealth.com.
Awesome, Evelyn. This has been so fun. Thank you for stopping by the Modern Customer. Enjoy the rest of your day, and we'll definitely get you back on the show really soon.
Super, thanks so much, Blake, it's been a pleasure.
Thank you. Everybody, you're tuning in to the Modern Customer Podcast. Until next time. Thanks for watching. Please don't forget to like or subscribe and follow my social content on other platforms where I post content daily, including X, Instagram, LinkedIn, TikTok, and more.